For our project, we will be discussing the disorder Xeroderma Pigmentosum by Maddie Gala, Abby Fiker, Jade Melankovic, and Morgan Barone. We found the topic Xeroderma Pigmentosum interesting because of what we learned about it in our lab called Soaking Up the Rays. Also, we saw a movie trailer for the new movie called Midnight Sun, which is about a girl who suffers from this disorder, and we wanted to learn more about it. The disorder Xeroderma pigmentosum is a rare skin condition that causes sensitivity from the UV rays caused usually from the sun. It greatly affects the skin and the eyes, and the common symptoms are blisterings of the skin, freckling, and cancer spots.
Skin fibroblasts can repair DNA damage by inserting new bases into the DNA where there was damage done from ultraviolet radiation. Cells from people with the genetic disease Xeroderma pigmentosum have a mutation in their cells where repair replication of DNA is either absent or reduced. People with this genetic disorder develop fatal skin cancers when they are exposed to sunlight radiation and there is a failure of DNA repair. There are many different forms of XP based on the gene that is impaired. 97% of patients reported basal and squamous cell carcinomas occurring on the head, neck, and face. Ocular abnormalities like corneal opacity lead to blindness. Neurological abnormalities lead to mental deterioration and immature sexual development. Other symptoms for this disease include severe sunburn when exposed to only small amounts of sunlight, development of many freckles at an early age, rough surface growths and skin cancers, eyes that are painfully sensitive to the sun and may easily become irritated, bloodshot, and clouded, blistering or freckling on minimum sun exposure, spider veins, limited growth of hair on chest and legs, scaly skin, dry skin, irregular dark spots on the skin, and corneal ulcerations.
Xeroderma pigmentosum is caused by mutations within genes that control the DNA damage response process, the process that fixes damaged DNA. More than half of the cases within the US are from these three genes: XPC, ERCC2, and POLH. The main one that we're going to focus on, though, is XPC. XPC is located on chromosome 3, and it codes for a protein which is located in the nucleus of our human cells and is responsible for sensing the DNA damage and participates in DNA binding within the XPC complex. This complex recognizes and interacts with unpaired bases on the undamaged DNA strand. It is responsible for components in the NER process as well. ERCC2 codes for protein involved in transcription-coupled nucleotide excision repair, an important process for repairing DNA damage. In its normal function, unwinds the DNA around the lesion to allow excision to take place and a new DNA fragment to be laid down. POLH codes for a specific Y family of DNA polymerase. It bypasses the lesions and suppresses the mutagenic effect of the undamaged DNA when replicating the DNA. Other genes that cause XP are DDB2, ERCC3, ERCC4, ERCC5, and XPA. XPC accounts for 43% of XP patients. Many alleles change due to duplication and deletion, creating an autosomal recessive disorder that is Xeroderma pigmentosa, and it is passed on through the parents. A change in this protein causes the NER process to function incorrectly and not be able to repair DNA. For ERCC2, it accounts for 28% of XP patients, and POLH accounts for 7% of XP patients.
Our online peer-reviewed article is by Jennifer O'Black from the Division of Pediatric Pathology. It was published in 2016. The journal summarizes the studies done on XP and recognizes the importance of learning more about UV-induced DNA damage and how the human body adjusts to that damage under normal conditions and when repair systems are defective. The article also talks about how it's an autosomal recessive disorder. The article also talks about the genes associated with Xeroderma pigmentosum. These are called complementation groups. The genes consist of XPA through G and XP variants such as XPV. They also consist of ERCC1, CSA, ERCC6, GTF2, H5, TTDN1. and further studies show heterogeneity in the molecular abnormalities compromising XP, which means this disease is inheritable. A second journal article we found by Daw and McGuire is about a study about a case of a patient at 62 years old getting diagnosed with a slight form of XP. It talks about how she was a farmer and she worked out in the sun a lot and she got a lip carcinoma. And she was 62 years old, even though XP patients usually don't last over the age of 15. The trace levels of XPA protein found that there were moderate DNA synthesis. Article also shows that XP can hide and appear as skin cancer based on the study of the older women.
To treat this disorder, chemical sunscreens have been developed over the years to help absorb the sun's UV rays. Some of the common treatments are known as the para-aminobenzoic acid, which was the first agent that was developed, but its potential to cause allergic reactions has limited its use. Another one is known as the benzophenones, which mainly block UVA but are strong UVB photoprotectors. Another one is the avobenzone, which is a strong UVA protector. PABA esters, salicylic Cs, and cinnamides all block UVB. The newest treatments that have been developed in the past couple of years are known as these broad spectrum sunscreens, which were developed to block both UVA and UVB. These formulas were also designed to be water resistant. The limitation to this is that they are helpful, but they're not 100%, meaning they won't cure the person with the disorder. A research trend for Xeroderma pigmentosum is on the enzyme T4 endonuclease 5. This new approach to photoprotection is to repair DNA damage after it has been exposed to UV rays. This can be accomplished by the delivery of a DNA repair enzyme into the skin by means of specifically engineered liposomes. T4 endonuclease 5 has been shown to repair cyclobutyl pyridimers resulting from DNA damage. Another research trend is on gene therapy, but this is still in a theoretical and experimental stage. Various methods of correcting the defects in Xeroderma pigmentosum have been attempted in vitro and in animal studies carrying the gene replacement products. For skin grafting, research has been done on grafting skin that has the genetic defect corrected, which may be useful for this disorder in the future.
Quick facts for XB includes how it affects 1 in every 250,000 people in the general population base. There are a number of known cases of XP in the United Kingdom, which is 100. The age that skin cancer can begin to develop in children is 4 years old when they have a confirmed case of XP. People with XP are advised to visit with a dermatologist every 3 months, have regular eye checkups, and have a neurologist included on their treatment team. Neurological problems occur in 1 of every 5 XP patients. Without any sun protection, children with XP generally develop their first case of skin cancer by age 10. XP has a gene frequency of 1 in 200. XP affects both genders equally as well as all races and ethnicities within the general population. There is no known cure for XP. Standard treatment protocols include high levels of skin protection, including clothing and sunblock when sun exposure becomes necessary. The use of oral retinoids can help to decrease the occurrence of skin cancer in people suffering from XP. For those younger than 20 years of age, the prevalence of skin cancer is almost 5,000 times what would be expected in the general population. Non-melanoma skin cancer's risk may be increased by 150 times when there is XP confirmed as a diagnosis. The average lifespan for someone with XP who does not have a neurological degeneration is 37. When neurological degeneration is present, the average lifespan is 29.